Thank you all, and for the nice words, Stella and colleagues. Okay, through the eCAN, what I'm going to present is the technical part. This is something that we did in collaboration with the Aristotelian University in Thessaloniki. And this was the main part that was used as that's the backbone of the whole project. Okay, so starting from a short overview of the project, these are the key components and the key stakeholders that were involved in the project. Starting with the patients, okay, the clinicians, and then the administrators that had to maintain this system and keep it alive. The system that was developed through the eCAN was mainly based on mobile apps. Those mobile apps were developed both for Android and iPhone devices. And those apps were used in order to monitor patients through a period that I'm going to show. Then we had the dashboard on the other side where the clinician could record any information in relation to the patient and see the results from the apps and have that control of the pilot. And on the other side, we tested wearables where we had some interesting results, and these are things that also going to show. Okay, the idea is to have, the data flow, we try to have them as seamless as possible. We didn't want to keep the patient continuously using an app. We try to do that as simple as possible in order to not to the patients are already in a case that it's stressful and all those things. So the idea is to try to monitor them, help them, but do that in the best possible way. In a seamless way as possible. Okay, and for sure, anything that was recorded, transmitted, and all those things were done according to the GDPR and anything that had to do with those rules. Okay, this is an overflow of the information that was. I think I do not have a mouse. No. Okay. Of the information that was collected and distributed through the eCAN. So if we start from the upper left side, you see the patient. Then we have the two groups of patients. One patient, thank you. One patient is the control group, and the other is the intervention group. The control group, that was a randomized control trial, the testing of the system. The control group was a group of patients that were following the typical procedures. The intervention group was the group that was using the eCAN in order to see if we can, the results we could get from the use of these apps. The control group now, you see here that the pilot had a duration of 8 weeks. Through those 8 weeks, we were using wearables to monitor the patients continuously. We were using a quality of life questionnaire in order to get feedback about the quality of life that the patient was giving us. Then we had the pain and distress thermometers, which are typical. These are standardized questionnaires that are already used by the clinicians. So we introduced those questionnaires in the app. So the patient could log in. I will show you later on. And for each week, the patient was getting a notification about the week, about the questionnaire that had to be answered, and get that information at the end. On this side here, we had the clinician. The clinician was able to record initially the ECRF. That is a basic medical record for oncology patients that was designed. We kept the information needed to monitor the patients. and the clinician was able to add notes during after the sessions that the clinician was having online with patients. So in addition to the app, we had online sessions of the clinicians with the patients in order to monitor, give some exercises, the physiotherapy exercises, psychology, we talk about recursive patients. And so after these sessions, the clinician was able to record based on a structured questionnaire, just to have something that was comparable, and on a questionnaire, on a free mode that the clinician could enter some information in the system. Okay, and then at the back end, we have the administrator and the cloud server where these things were stored on. And as I said, everything was done to follow the GDPR rules in a strict way. Okay, this is a general overview of the system. That is a symbol diagram. You see here the mobile app, the dashboard of the clinician, the collection of data from the patient, and the area where we collected all data and were displayed to the clinician. So we use them to get the results later on. Then this is starting from the clinician's dashboard that was developed by our colleagues at the Aristotelian University. The dashboard was used from the clinician to do online sessions using the EduMeet platform, which was a platform that was developed through another European project. It was used to record the case, the ECRF data, the data about the case of the patient, then the meeting notes, and the patient data that were coming from the mobile apps of the patient. This is a snapshot of what the clinician could see. You can see here the patient list, so a clinician could see his or her patients, was able to find details about the project, help, open the EduMeet to do the online sessions, correct the profile. You see here that the ECRF was actually, we selected data like demographic data, diagnosis data, living arrangements, travel that the patient had to do, experience with telehealth, sleep habits. All these were recorded in the ECRF. And the clinician was able to record notes. So the notes were either subjective or objective in order to get, and at the end we had an assessment plan that was a free text that was recorded from the clinicians. Okay, on the other hand, the clinician was able to see the prompts, the patient reported outcome measures that were coming from the mobile apps of the patient, and at the end, the PREMs, the evaluation measures that were recorded at the after the 8th week. The patient had to complete the evaluation of the system just to get the results there. So the eCAN mobile app now, as I said before, was used in order to track health metrics using the URTCQLQ-C30 questionnaire. We were recording the data related to the quality of life of the patient, and the other things that were used were the pain and distress thermometer. So these are two, again, these are standardized scales used worldwide. I guess that most of you know them. So the patient could express the level of pain or the level of distress for each week. Another task that was a bit difficult is that these systems were tailored for different languages. So the patient had to we had to include an easy way to switch from one language to another. That was a task that had some problems in the translation. Okay, at the end, we managed to have it for 9 different languages. As I said, it was based on weekly reminders on the app. Okay, the effort was to design something minimal, to restrict the access for each week, and have something that was that would not put more stress on the patient. Okay, this is an overview of the mobile app where you can see the login of the patient, and you can see here the weeks notified for the questionnaires that had to be answered for each week from the patient in weekly use. The patient could answer these questionnaires and could see what was answered before, could give a different, could give a second questionnaire if the patient wanted, and so we could get some more data about this. About the patient and how was the general feeling. Okay, and in addition to that, we tried to use some wearable devices. I'm going to be fast here. I'm not going to do the analysis, the statistical analysis. Wearable devices, mainly we tried to see if we could find statistical significance between the results that we were getting from the wearables with the answers that the patient was giving. Okay, for some questions, we could see that. For example, we were monitoring the quality of sleep, the continuous sleep hours, and we were able to find some relevance with questions about the fatigue and the overall, the overall idea of the patient about his condition and how was the patient feeling. Okay, these are statistical numbers and the relationship that we had from the wearables to the questions of the QLQ. Okay, the wearables mainly is something that we intend to expand it and do some more research in the eCAN Plus, which is the new project that is starting. Okay, this is the ecosystem that was developed actually through the eCAN project, and this is the ecosystem on which we are based in order to continue with the eCAN Plus, starting with the clinical data, the data that I said before, and at the end the analytics, where we are trying to give some general overview to the clinician. Okay, and this was the idea that was used in order to do the pilot tests. The results were presented by my colleague here before. Okay, the applications of the eCAN Plus can be downloaded. They are on Google Play and Apple Store, both of them. We have a demo app, which is also on the Google Play, on the Apple Store. It was not allowed just to have a demo app because Apple has a strict procedure that if you do not have something that is collecting data, you cannot give it online. So this can only be downloaded with a testing mode. So if anybody wants to see the results of the eCAN, you are most welcome to download them. We have the links on our website. Okay, that's it. Thank you.